Let's continue our discussion about our skeletal bones. We're going to talk about two types of bone growth. We're going to first talk about our interstitial growth, which is basically our longitudinal growth. It's the growth for your bones to grow in length. Apositional growth is when your bones grow thicker, so they grow in width. Let's talk about interstitial growth, which is your bones growing in length. And basically that's how we grow taller. If you think about it, growing taller, we don't grow taller forever. Females, they stop growing taller when they hit 18 or 19 years old. Males, they stop growing taller when they are about 21 or up to 23 years old. So the reason why we cannot continue interstitial growth forever, and there will come a time where we cannot grow any taller, is because we start losing that epiphyseal growth plate right here. So this is an image of a long bone. So here's your proximal end. Let's say this is your proximal epiphysis, and here is the shaft. Here's the diaphysis. There's right here a piece of cartilage known as the epiphyseal growth plate. The reason why we stop growing taller is we lose that growth plate. That growth plate is completely going to ossify and turn into bone. So let's talk about what happens. So if we zoom in on the piece of cartilage that we have right here, this is how it looks like. It's divided into several zones. Up at the top, we call it the resting zone, proliferation zone, hypertrophic zone, calcification zone, and ossification zone. So again, this whole piece of cartilage is right here. Above it, there is spongy bone, and below it, there is spongy bone. So what happens is that piece of cartilage is going to start growing, and as it grows, it will push up. As this piece of cartilage is growing and it pushes up, it's going to push your bone upwards, and that's how we grow taller. But at the same time, your cartilage is growing and pushing upwards, and therefore making your bone, again, gets pushed upwards, so it makes your bones grow in length. At the same time, the spongy bone down here is actually deteriorating the bottom of your cartilage until that spongy bone down there deteriorates and takes over the whole entire cartilage. Once that spongy bone takes over this whole entire piece of cartilage and that piece of cartilage completely deteriorates, that's when we stop growing taller. So for females, that piece of cartilage, the epiphyseal growth plate, is going to completely deteriorate by the age of 18 or 19. For males, that piece of cartilage is going to deteriorate by the age of 21, or some say up to age of 23. So let's see which part of the cartilage is going to be responsible in dividing and actually pushing against your bone, making us grow taller. It's this zone right here, known as the proliferation zone. So this zone right here contains cartilage cells that are highly active in dividing. And so as they divide, those new cartilage cells are going to be pushed upwards. As those new cells are being pushed upwards, it's going to push against your bone, again, making your bone grow in length. But at the same time as this proliferation zone is dividing and it's pushing against your bone, at the same time, the cartilage down here is deteriorating. So right here, there's a zone known as the hypertrophic zone. Notice how the cartilage cells, they are starting to look pretty old and they are enlarged. And then down here, this zone is known as calcification. What's happening is calcium is being deposited, and when calcium gets deposited within the cartilage, it kind of hardens it, and it makes the nutrition harder to get to the cartilage cells. So the cartilage cells are starting to die. Now, as the cartilage cells are starting to die right here within the calcification zone, the spongy bone remember how I said there's spongy bone down here? The spongy bone is actually going to start taking over. So that's why we call this zone of the cartilage ossification, because the spongy bone is going to start taking over and it's going to start calcifying the cartilage. So it's going to start actually completely destroying it and puffing spongy bony matrix. And so the ossification is going to start kind of creeping up on the cartilage, and the cartilage is going to continue to deteriorate, and as it deteriorates, spongy bone is going to start kind of taking over, and that process continues, the process of the spongy bone kind of creeping up on the cartilage and puffing bony matrix. That process continues until the whole entire piece of cartilage is gone and all you have is spongy bone. That's when we stop growing taller. Now, the reason why females actually stop growing taller faster compared to males, it has something to do with the female sex hormones. So the estrogen production in females actually deteriorates the epiphyseal plate faster. And as I said, once that epiphyseal plate closes, meaning like that's it, no more hyaline cartilage, and all you have left is spongy bone, that's when you cannot go through any more interstitial growth. A positional growth, it's when your bones are growing in width. So notice how here your bones are getting wider. Now, apositional growth has no age limit. We can actually go through apositional growth our whole entire lifetime. And what triggers it is how much stress you're putting on your bones. So the more stress you actually put on your bone, the more your bone is going to grow in width. And so therefore, if someone works out and they start getting buff and they start, let's say, growing more muscles, these muscles are basically putting pressure on your bones. So the more you grow muscles, the more pressure and the more stress you're placing on your bones are going to sense that, and they are going to start to puff out more bony matrix so that your bone will grow in width. Now, the thing is, though, you don't want your bones to become too thick and lose their correct shape. And again, you don't want them to become too thick because then your bones are going to be very heavy. And so as your bones are growing in width, some of the old bony matrix gets deteriorated by the osteoclasts. So the osteoclasts come in and they start breaking down some of the old bony matrix to make room for the new bony matrix to be deposited. But for your bones to grow in width or to grow thicker, your osteoblasts are going to be working faster compared to your osteoclasts. So you're going to be depositing more compared to breaking down the old bony matrix. Another thing is that if, let's say, someone is right-handed, your right arm, your right hand, etc., is actually going to be thicker compared to your left one, and vice versa. If someone is left-handed, their left side is going to be bone-wise, their bones are going to be thicker on that side. And that just has to do with how much you are using that bone and how much stress you are putting on it. The more stress you're putting on it and the more you use it, the more it grows thicker. If you do fracture your bone or break your bone, first thing to treat it is you need to realign your broken ends. If your broken ends are not realigned properly, one thing is that your bone will have to be rebroken for them to realign it again. So that's the first thing. You want to realign it so that it could heal properly. So sometimes the physicians have to manipulate your broken bones to put it in the correct position, and we call that closed reduction. Sometimes what we refer to as open reduction is when the physicians are going to have to place some surgical pins and wires, and actually you will keep those pins and wires forever to secure your bones, especially if you've fractured your bones into so many little pieces. Then you will need those surgical pins. Sometimes also they put it, they hold it together by a cast. And again, the whole point of the cast is to prevent mobilization, to prevent movement, so that your bones can stay realigned during the healing process. So what happens is when you break a bone, you will have bleeding. And so you're going to have a whole lot of like internal bleeding, and you're definitely going to have swelling because of all of that accumulation of blood. It's definitely going to be painful. We call that a hematoma. So you're going to have basically like blood clotting right here, and pooling, and so that's a hematoma. Now your bones are going to start the healing process. So your osteoclasts are actually going to come in, and they are going to break down and eat up the damaged bony matrix. And what's going to start happening is we are going to form what's known as a fibrocartilaginous callus. So where you've broken your bone, a piece of cartilage is actually going to develop, and that cartilage, as you can see, it's kind of like holding your broken pieces of your bones together. You can think of it as a natural cast that you've just developed. And then what happens is the blood vessels, they are going to start to redevelop. So your blood vessels are starting to regrow and redevelop, but we can't keep that piece of cartilage, right, forever. We want our bone back. And so that piece of cartilage starts to deteriorate, and your osteoblasts come in, and they are going to start puffing out the bony matrix, and it's going to start looking like spongy bone on the inside, and then it's going to go through some structural change to make it look like compact bone on the sides, and you can kind of see the swelling is getting better, and that process is going to continue until you have kind of complete sealing that's going to take place between the bone, like the broken bone ends. And that's when the remodeling is going to finish. Like you have spongy bone on the inside, you've kind of the structure right here on the sides are going to change to make it look like a compact bone. If you've broken, let's say, the shaft of your long bone, which has a medullary cavity, osteoclasts are going to come in, and they're going to start kind of breaking some of that bony matrix that was just that was just deposited to make room for that cavity. It depends how long the process takes, depending on which bone you broke. So definitely the larger the bone, the longer it's going to take for it to heal. So if you've broken your femur, which is your thigh bone, it's definitely going to take way longer compared to if you've broken your arm bone. The more complex, or the longer the bone, etc., the more time it's going to take for it to heal. Now, when someone develops osteoporosis, osteoporosis is when your bones are actually breaking down faster compared to you're breaking down your bone faster compared to rebuilding it. This image right here shows you a normal spongy bone, and this is an osteoporotic bone. Notice how like thin and kind of it looks very fragile. Osteoporosis normally occurs with age. So as someone ages, they can start developing osteoporosis. The most common places to have osteoporotic bones would be the hips, and that's why you hear a lot of older individuals, especially if they fall or if they trip, they break their hip bones. pretty easily because their hip bones would usually be very fragile and osteoporotic, like so. Another common place is the vertebra, the back. So those are two common places to get fractures, especially when someone is older. Um, Other than age, what other risk factors for osteoporosis? They say the more petite the body form is, the more risk those individuals are for developing osteoporosis. Um, if you don't really exercise that much and you're not really putting that much stress on your bones, remember how we said when you put stress on your bones become thicker? So the less exercise, the less stress as you age, you can actually be more at risk of developing osteoporosis. If your diet is not really it's not really that healthy, and especially when it comes to your calcium intake and your protein intake, if those two are like pretty low, then again your bones are going to tend to become weaker and more fragile and more susceptible to fractures. Smoking and drinking too much soda actually leaches the calcium out of your bones. Um, so it kind of grabs the calcium out of your bones, and without calcium, again, your bones become weaker and weaker. Um, Diseases or disorders such as hyperthyroidism, when your thyroid gland in your neck region is very highly active, that can actually again leach the calcium out of your bones, making your bones weaker. As we said, immobility. So again, less exercise can also lead to osteoporosis. Some of the treatments to treat osteoporosis, like you would take calcium supplements, vitamin D. Why vitamin D? Because vitamin D actually helps you absorb more calcium. Exercise, especially weight-bearing exercise, where you're putting stress on your bones. Hormone replacement therapy, so especially with women when they hit menopause and they are producing less estrogen. Less estrogen can actually lead to osteoporosis. So one treatment is to get estrogen hormone therapy, but it does have very, like, research has found that it does have negative side effects. So taking estrogen hormone therapy can actually put the female at more risk of getting a heart attack or getting a stroke or getting breast cancer. So um, yeah, so it's definitely tough if someone has to make that decision of getting hormone therapy or not. They have to kind of know, like, that this, all of these, like, can happen. Um, so definitely, like, exercising, taking care of your diet throughout, like, your younger years will definitely help you out as you age. Um, to prevent osteoporosis, like as I was saying, like, make sure that your diet is containing enough calcium, because otherwise your body is just going to break down your bones to get the calcium that it needs, and so definitely that's going to put you at more risk of developing osteoporosis. Um, Less consumption of carbonated beverages, alcohol consumption, smoking, all of this can help prevent osteoporosis. Sometimes, though, osteoporosis is also due to genetics. So some people are just more susceptible to developing osteoporosis compared to others. And definitely staying active and plenty of weight-bearing exercises throughout your lifetime.